Welcome back. In our previous explainers, we really dug into what NHCX is. Now it's time to move from theory to practice. In this session, we're going to focus on the tangible, day-to-day impact of NHCX standardization. We'll look at how this common protocol is fundamentally reshaping the work of hospitals, TPAs, and insurers right across India.
So, before NHCX, let's be honest, the health claims ecosystem was really running on a patchwork of custom, bespoke processes. For any administrator, this meant dealing with fragmented communication and just constant ambiguity. In day-to-day operations, this translated to endless manual follow-ups, which naturally led to delays and errors. Now, with NHCX, we're seeing a clear shift. We're moving to a standardized, predictable environment where every single action is auditable. With this changes in practice is a move from chaos to order. It's a true operational turning point.
Now, it's really important to understand that NHCX isn't a new piece of software or a platform you log into. It's much better to think of it as a standardized rulebook. You see, it establishes a common vocabulary and very predictable procedures for how information is exchanged. It's like a shared operating language that everyone in the ecosystem agrees to use. And that's what completely transforms the daily operational experience for everyone involved.
All right, to really understand this transformation, we're going to examine 4 key shifts. First, how we move from ambiguity to clarity. Second, how we establish true accountability in the system. Third, how we replace all that guesswork with predictability. And finally, that big transition from opaque black boxes to transparent glass boxes.
Okay, let's begin with our first point. This shift from ambiguity to real clarity. You know, in the world of health claims, clear communication isn't just a nice-to-have. It's an absolute strategic necessity. Every single instance of miscommunication leads directly to administrative waste, to delayed patient care, and of course, friction between providers and payers.
So how does NHCX establish this clarity? Well, it does it in 3 distinct ways. First, through what we call structured conversations, where all the interactions follow a very defined request and response sequence through the gateway. Second, through uniform digital paperwork. By using standardized data formats, we just cut down on all that back and forth caused by incomplete submissions. And third, and this is key, it provides clarity even in failure. So instead of a vague rejection, the protocol mandates specific error codes, which allows for immediate diagnosis and a much faster resolution.
And that brings us perfectly to our second point, establishing true accountability. You know, trust in any system really depends on accountability, and previously, the absence of a clear, auditable trail was a constant source of disputes. Was a message sent? Was it received? Was it processed correctly? There was often no way to know for sure. The solution here is actually quite elegant. It's the introduction of a unique tracking code for every single transaction, the correlation ID. This simple identifier becomes the very foundation for an unambiguous chain of communication. With it, every request, every response, every message is tagged, creating a crystal-clear record from start to finish. The best way to think about the correlation ID is that it functions almost exactly like a package tracking number from a courier service. It allows any party involved to monitor a message's entire journey, right from the provider, through the gateway, to the payer, and then all the way back with a response. This simply eliminates the guesswork entirely. And what's more, the system has persistence built right in. If a request doesn't reach its destination for some reason, the NHCX gateway will automatically retry up to 5 times before it marks the transaction as definitively failed. This ensures there's always a final auditable outcome recorded, creating a truly reliable system of record.
Now this brings us to our third area of impact, replacing all that guesswork with predictability. I mean, for any administrator, predictability is the absolute cornerstone of operational efficiency. Just knowing how and when information will be exchanged allows for so much better planning and much smoother workflows.
Let's just quickly examine the rhythm of a typical eligibility check now. A staff member initiates a standardized request. The gateway immediately acknowledges it, providing a digital receipt, which means no more manual follow-ups needed. Then, a little later, the detailed response arrives asynchronously. This defined 3-step process creates a predictable rhythm that frees up staff to focus on more productive work.
Finally, let's explore our fourth point, this powerful shift from black boxes to glass boxes. In practice, what this really means is moving from these opaque, unknowable systems to ones that offer complete operational visibility to everyone.
Think about it. The pre-NHCX environment often functioned like a total black box. A hospital would submit a claim into a payer's system with very little insight into its status.
The staff would then just have to wait, sometimes for days, before getting any kind of response, with absolutely no way to check on its progress in the meantime. NCHX completely transforms this into a transparent glass box. Because all communications flow through the central exchange, it becomes the single source of truth. A self-service status check function empowers both providers and payers to look up any transaction status at any time. And the protocol headers also create this rich end-to-end audit trail. This level of visibility fundamentally changes the dynamic, reducing disputes and building real trust.
So, in conclusion, what does this common protocol really mean for daily operations? Well, the changes that NHCX introduces are far more than just technical improvements. Establishing these shared rules brings clarity, accountability, predictability, and visibility to a very fragmented ecosystem. It really does represent a fundamental operational shift.
Ultimately, this common language isn't just about optimizing the processes we have today. It is the essential, foundational layer upon which a more intelligent, a more automated, and a more responsive healthcare ecosystem for all of India will be built. It truly marks the beginning of a new chapter in how our country's healthcare stakeholders communicate and collaborate.